And for some background, what is Becker's Hospital Review?
Becker's Hospital Review is the country's largest healthcare media organization. We're based in Chicago, and we cover the, we cover healthcare news as it's related to the executives running the country's largest healthcare organizations.
So you're an expert in this topic. So with that being said, you're up to speed on how UAB Health System is set to acquire Ascension St. Vincent's.
Correct.
This news come as a surprise to you based on your research and your findings previously?
I think at a high level, it's not too surprising. Ascension has been selling hospitals in several states over the last few years and has said it has plans to continue doing so. The organization is looking to continue to improve its operating performance and long-term sustainability on the back of some financial challenges the last year or so.
And I know that there is from the patient side of things, there's mixed feelings about, what this means in the long term. I just kind of wanted to touch on that um with both sides of the argument. So I want to talk a little bit about the pros of this and the cons of this.
Yeah,
But I guess my first question would be with the, a hospital the size of UAB, and it's clearly getting bigger. Does that give UAB more negotiating power when working with insurance providers? And how will that impact people with coverage when they pay those premiums? I know it might not be, next year, but in the long term.
sure. Yeah, it does give you more negotiating power. A bigger health system has more negotiating power with insurance companies. But maybe it would be helpful if I started from the pro side of things in terms of patient perspective. Patients who normally go to these Ascension hospitals will gain access to a larger network of healthcare services and providers at UAB, which of course is one of the nation's leading academic medical centers. And we also know that UAB Health has said that it aims to strengthen hospitals in Alabama, especially as we've seen other hospitals around the country have to close because of financial difficulties. So the bigger context here and the reason why hospital systems use consolidation is they want to get bigger and they want to stay profitable in an industry that is seeing a lot of financial challenges right now. By getting bigger, this helps offset your costs. And like you said, you also have more negotiating power with insurance companies. Being bigger also, though, means less competition in the local area, which can also mean higher reimbursements from insurance companies, which then means higher healthcare costs for patients and people with health insurance.
So, in your professional opinion, what is a what does an acquisition on this scale mean for healthcare in a community?
It means a lot of things. It means that two brands and two large organizations that people know well are going to be having to come together, which there can be growing pains there. Again, from the patient perspective, that means that you're getting a lot more access to UAB's providers and services that they offer. In the long term, not just in this specific situation, in the long term, studies have shown that it can increase consolidation with hospitals can mean less competition and higher healthcare costs in terms of insurance premiums in the long run. But that's not a guarantee that that will be happening in this situation. The national context here is that proposed hospital mergers and acquisitions are continuing to face a lot of backlash from physicians, from state and federal lawmakers. Becker's has reported last year on at least 10 called off hospital deals, many of which were in part because of federal or state interventions. So it's a difficult environment right now for hospitals to merge.
In the long term, when you have a merger, are patients ultimately better off? I know it's probably hard to say.
It's hard to say. It's different in every single market. And how, it's difficult to say that one patient will be better and another will be worse. It is truly different in every market. But like I said, if you're going to these Ascension hospitals right now, you're then going to gain access to all of UAB. So that in that perspective, that's a very good thing for patients. But then again, if you look at what studies have shown more broadly across healthcare, it can decrease competition, which then leads to higher prices. But will that happen in a specific situation? It's hard to say. You'd have to look at, the specific market and how competition will be affected.
And you
And it's
touched
for
on
the regulators to review.
and you touched on something there, just talking about competition. I know you're based in Chicago, but I mean, here in Birmingham, you may already know this. You've got UAB and then Ascensions and then Grandview and Brookwood. I
Okay.
mean, when you get rid of, and UAB kind of takes over one of those and we have less competition, I mean, what does that mean for people who say, well, I don't want to go to UAB?
If UAB is the only hospital available in your specific area and that's the service that you're most interested in and you don't want to go there, that could mean that you would have to travel further to not go to a UAB facility if that is only what's available to you in terms of what your insurance covers and the specific service that you're looking for. So in theory, if UAB was the only organization available to you, you would have to travel further to go get services that you're interested in. But again, I think that's going to be very dependent on where somebody lives.
Right, of course. And then I guess on behalf of the viewer, people that watch us, one thing they care about is, hey, how is this going to affect me, my wallet? I mean, it's no secret right now that people are struggling in this economy with cost and that sort of thing. Are you able to touch on, maybe from what you've seen in other places with any acquisition or something along those lines, on how much of an impact will that have on people potentially?
Yeah, I'll be totally honest with you, Valerie. This one's a tough one to answer because how healthcare economics usually works out, you don't see the effects of these kind of things for years, sometimes 4 or 5 years down the line. And it can be difficult to trace, let's say, an increased insurance premium directly to a hospital merger. So, I don't want to say, on the record that patients' costs are going to be going up or insurance premiums are going to go up because of this. That'd be too difficult to say. In the immediate term, what it means is that a patient has access to UAB that they might not have had before. And so from that perspective, that is a good thing. But what studies and research has independently confirmed is that when consolidation occurs and less hospitals are available across different kinds of organizations, competition goes down, and in the long term, healthcare costs go up.
Thank you so much. That was helpful. Is there anything else that I didn't ask you that you want to add or say or touch on this topic?
I don't think so. I think if you're going to be speaking directly to any executives or people involved with these deals, I would ask them, how do you plan to overcome some of the hurdles that we've seen systems this year alone that they're not, that regulators are not approving these deals, especially the FTC. How do they plan to overcome that?